In this video, I want to consider the goals of a physical therapy program for dogs that have been diagnosed with degenerative myelopathy. The dog is not going to be rehabilitated. So what do we do? The first goal in the program is to retain muscular strength in the hindquarters and the rear legs. Many of these dogs already have weak gluteal muscles and atrophied thigh musculature. Pain, unless there are other conditions in the individual, pain is not a symptom of degenerative myelopathy. But strength is a huge component of the program because muscular strength will keep the dogs upright as the nerve function decreases. It is more difficult to build muscle than to maintain it. Her early diagnosis and inclusion in a physical therapy program increases the success of the program. These exercises can take the form of active exercise, particularly hydrotherapy, and passive exercise, which has more to do with static exercises and weight shifting, and so on. Although the disease is progressive, challenging the neural pathways assists in maintaining these pathways. Hind limb awareness and proprioceptive exercises play a large role in a degenerative myelopathy program. Many of these exercises also have a strengthening component. You will reach a point where the challenge will become too much for the dog, and the program must be adjusted accordingly. In instances where the proprioception gets to a point where the dogs are dragging, there are a number of assistive devices that could be used. There could be something like a Bico brace, a dorsiflex assist, or something which assists to lift the toes as the dog walks, so there's less dragging. And as the disease progresses, obviously one could look at a mobility cart for these dogs as well. Most dogs with degenerative myelopathy shift their weight to their thoracic limbs, and this can result in pain if there's joint pathology in the elbows or shoulders and even the carpal joint. Be certain to look for this. The weight shift will also cause soft tissue restrictions and muscular tension. So a good degenerative myelopathy program addresses these soft tissue changes by applying massage, heat, myofascial release techniques, any of the above or a combination of them, to relieve the tension and to facilitate movement, comfortable movement, for as long as possible. How do we know if our program is being successful? Do we wait for 2 years and then declare that it was successful? No, we don't. We need to include regular evaluations in the program. And these evaluations should include sequential neurological examinations. So let's look for what is changing. How is the disease progressing? And how must the exercise be adjusted to accommodate these changes? To push the dog into or to maintain exercises which the dog is physically not capable of performing creates a great deal of stress, and stress is contraindicated in dogs with degenerative myelopathy. Any form of stress, physical, emotional, mental. The theory is that stress creates oxidation, and we know that it is an oxidative process that is adversely affected by the mutation in the SOD1 gene. We can also measure thigh circumferences to assess the efficacy of the program. It's a very useful tool. So this also allows us to have conversations with the owner, and we're constantly evaluating, and one day we will get to a point where a decision is made, but we will have done everything that we possibly can to improve the quality of life of this dog and to create longevity and happiness within the family.